Uterine fibroids are common growths that develop in or around the uterus, and many women may have them without knowing it. To understand fibroids, it helps to first understand the normal anatomy of the uterus. The uterus has an inner lining called the endometrium and a thick muscular layer called the myometrium. Fibroids develop from smooth muscle and connective tissue within or around the uterus. The exact reason a particular uterine cell begins forming a fibroid is not completely understood. Genetic factors appear to play a role in why some women develop fibroids. Reproductive hormones, including estrogen and progesterone, also influence fibroid tissue. Under the influence of complex biological signals, fibroids can remain small or gradually increase in size. Fibroids can cause more than heavy periods. But what actually makes them form? And which warning signs should you never ignore? Stay with us because we're about to break it all down. Some women develop one fibroid, while others develop several. Fibroids can also vary considerably in size. The location of a fibroid matters because different locations can produce different symptoms. A submucosal fibroid grows toward the inner cavity of the uterus. An intramural fibroid develops within the muscular wall of the uterus. A subserosal fibroid grows toward the outside of the uterus. Two women can have fibroids of similar size, but experience completely different symptoms because of their location. An important warning is that fibroids can exist without causing any noticeable symptoms. One of the most common symptoms is unusually heavy menstrual bleeding. Some women may also notice that their periods last longer than usual. Bleeding between periods can also occur and should be discussed with a healthcare professional. As fibroids enlarge, some women may experience pelvic pressure or a feeling of fullness. Pelvic discomfort can occur, although not every woman with fibroids experiences pain. Depending on their size and position, fibroids may also be associated with lower back discomfort. A fibroid near the bladder can sometimes contribute to urinary frequency or pressure. Fibroids positioned toward the back of the uterus may contribute to pelvic or bowel pressure. Large or multiple fibroids can enlarge the uterus and create abdominal fullness. Over time, persistent heavy bleeding can result in significant blood loss. Repeated blood loss can contribute to iron deficiency. In some women, this may lead to anemia. Anemia can cause symptoms such as fatigue, weakness, dizziness, or shortness of breath. When symptoms become persistent, fibroids can affect work, exercise, sleep, and overall quality of life. Having fibroids does not automatically mean a woman will have fertility problems. However, certain fibroids, particularly those that distort the uterine cavity, may affect fertility. Many women with fibroids have healthy pregnancies, although some pregnancies may require closer monitoring. Whether a fibroid matters for fertility or pregnancy depends on factors such as its size, number, and location. Diagnosis begins with your symptoms, medical history, physical examination, and appropriate testing. Ultrasound is commonly used to detect fibroids and determine their size and location. The ultrasound image can help clinicians identify the number and position of fibroids. MRI may provide more detailed information when additional imaging is needed. Blood tests may be used to look for anemia or other consequences of heavy bleeding. Doctors combine these findings to determine whether fibroids are responsible for the symptoms and whether treatment is necessary. If fibroids cause little or no trouble, monitoring without immediate treatment may be appropriate. Medications can help manage symptoms such as heavy bleeding or menstrual pain in appropriate patients. Some hormonal treatments can reduce bleeding and may temporarily reduce fibroid size. Non-hormonal medicines may also help control heavy menstrual bleeding in suitable patients. Myomectomy removes fibroids while preserving the uterus. For selected fibroids inside the uterine cavity, hysteroscopic treatment may be an option. Some fibroids can be treated through minimally invasive procedures, depending on their characteristics. Uterine artery embolization reduces blood flow to fibroids, helping them shrink over time. Radiofrequency ablation uses controlled energy to treat selected fibroid tissue. Treatment is not one size fits all. The right option depends on symptoms, fibroid characteristics, health, and personal goals. If you want to become pregnant, tell your healthcare professional because fertility goals can influence treatment decisions. Fibroids often shrink after menopause as reproductive hormone levels decline. Fibroid symptoms can change over time, so ongoing symptoms deserve appropriate medical evaluation. Because heavy bleeding and pelvic symptoms have many possible causes, self-diagnosis can be misleading. Tracking your periods and symptoms can give your healthcare professional useful information. Talk with a healthcare professional if heavy bleeding, persistent pain, fatigue, or pressure begins interfering with your daily life. Severe bleeding, fainting, severe sudden pain, or signs of significant blood loss require prompt medical attention. Knowing the warning signs can help you recognize when it is time to seek professional advice. Fibroids may be common, but every woman's experience is different. Learn the warning signs, understand your options, and speak with a qualified healthcare professional about your individual situation. Subscribe for more evidence-based women's health education.